certainly glad to be here to talk about something that I'm very passionate about, which is mental health in the workplace. And as Emma pointed out, a long career working with Allianz and undeniable growth in mental health, mental illness, conversations, number of claims, cost of claims that we're seeing in the industry that we work in. And as a large insurer across both the privately underwritten states across Australia and also the fee-for-service businesses, supporting 1 in 6 employers in Australia, we definitely can see the trend, as Jeff points out, continuing to become more a point of conversation going forward. In terms of the case for mental health, we know that every day millions of Australians come to work with a mental health condition. In fact, mental work injury now accounts for nearly 40% of all workers' compensation cases, costs at Allianz Australia in our portfolio. Adding further complexity to this overall picture is the rise in increasing secondary mental health that we're seeing across the claims that we're working with as well. And that isn't just in terms of volume, but also in terms of the costs, where we're seeing the cost of a physical claim with a mental health component as a secondary injury nearly 4 to 5 times the cost of a primary injury. Furthermore, we all saw the Productivity Commission draft report, that the cost of the Australian economy of mental health growing. The cost of mental ill health and suicide now estimated between $43 to $51 billion every year. And a really significant increase from the $8 billion just predicted last year by KPMG. So really steep estimate growth in the cost of mental health going forward. There was also some recent data released from the Australian Financial Services Council and KPMG recently about new data about the underlying causes of total and permanent disability claims in Australia. And for the very first time, the data's revealed the extent of TPD claims for mental health condition. And so what is that extent? The research was revealed that life insurers also pay out TPD claims caused by mental health for more than any other cause. And according to the data from APRA in 2018, life insurers paid out more than $4.8 billion to 26,150 Australian employees, expected to never, ever work again. If you do the math, it's telling us that in 2018, almost 2,000 Australians were deemed unable to ever to work again in their lives due to mental ill health in the workplace. So we look at the data, and there's lots of data coming through on this topic. It's clearly telling us that as employees, as employers, as an industry, as a community, as a global population, we're probably not doing okay in this space. But more and more research, data, initiatives and programs are starting to come to life in order to build further awareness to taking action. One of the things that we've worked on over the last 2 years was a research paper that's available online, which is titled Awareness into Action and the Journey Towards Improving Mental Health. We partnered with YouGov in order to gain some critical data and insights that would help us in formulating a holistic approach to cultivating mentally healthy workplaces. What do we find through the research? Employees let us know that stigma around mental health in the workplace not only exists, but it's creating a major hurdle in their ability to be mentally healthy at work. In fact, the vast majority of full-time working Australians, 93%, said they are uncomfortable about disclosing or discussing mental health in their workplace. Even more worrying, 85% of employees feel their manager is more likely to think they're genuine if they call in with a cold or flu than if they talk about the fact that they're feeling stressed or anxious in their workplace. Overall, most employees are afraid to talk about mental illness for fear of stigma, 90%, for fear of losing their job, 78%, and are concerned that mental health issues won't be taken as seriously as other conditions. Given these concerning results, we wanted to start putting the research into action through the implementation of key programs and initiatives, many of which align to the recommendations outlined in the Actuaries' Green Paper. So I'm going to dive into a couple of initiatives that we've been working on. The first one I'll talk about is the Work Well program, which aims to identify workers who are starting to show symptoms of mental ill health in efforts to connect them with qualified health professionals via digital platforms. The idea to be that early detection and providing a professional outlet to this worker can prevent more significant mental health issues down the track. There are a number of providers providing services like this in the community, and through assessment tools and psychosocial screening, we're able to identify people that potentially have that secondary mental health condition likely to emerge, and referral to an independent provider to help with that support has led to some really positive improvements. So we had a pilot with the Department of Education in New South Wales. We had 3,500 people that were triaged through this service. 148 people actually elected to take up the counselling support, return to work support. And in that cohort of claims, we saw a 7-day improvement in return to work outcomes for that particular group of workers. The other thing about detecting, I think data, and the point that Jeff made about collecting data on secondary psychological injury is very important. In Victoria, we worked with WorkSafe and a number of our employers for people that were exposed to occupational violence in the workplace. These were physical injuries that were incurred, but no mention of any other secondary psychological impact of that particular incident. So capturing through coding whether an occupational violence incident had occurred, our case managers were able to proactively speak to the people involved in that particular matter to see whether proactive support services and counselling services, and we offered 6 sessions for those people, were able to improve the return to work outcomes for that particular group of workers. One of the other things we're trialling, and this is not specific to mental health, is this coordination piece. And in July of this year, we're really trying to simplify the process. It's really clear from our experience and the research that is out there that the early identification, the early engagement with a worker, breaking down the complexity of how to navigate the workers' compensation system for all stakeholders in the process is really one of the key things that needs to be reformed in order to get better health outcomes for people with psychological injury, in my experience. So this has been a really relatively soft launch for us. We're kind of moving into this space. It's a personal app for people based on artificial intelligence. We've partnered with Deakin University, and we're offering this to people injured in the workplace. We're trialling it in New South Wales with a number of government agencies, Sydney Water, Department of Finance, and TAFE New South Wales. It's an assistant for workers in their recovery of journey, providing them with one platform for information. And it's intuitive and it's building information up as we go in order to help people to navigate the process. Take-up rate's about 20% of workers choosing to elect to interact with us in this particular medium. And interesting enough, and probably not a surprise to me, is the main types of questions we're getting relate to the determination of liability and when that process will actually happen and when the communication will happen in that place, in that particular part of the claims journey. And also some emerging information that people really want to interact with us in a much more digital way. So really wanting to send over information and forms to us electronically through the app going forward as well. So early days for us in this space, and we don't have the data to support it at this point in time, but we're certainly aiming to get both quantitative and qualitative feedback from the workers that have engaged with this type of technology when the pilot finishes at the end of November. So technology, I think, has an emerging place in the support of people with mental health in our Awareness into Action paper. There's a couple of really great examples from employers around the country, around some of the work that they've done. I really like one example of a utility company who recognised that mental health first aid training for their employees was one step, but didn't go far enough in terms of supporting their employees in the workplace. So invested in artificial intelligence, virtual reality training, which is actually allowing their mental first aid officers to experience what it feels like to have a mental health condition and come into the workplace and be exposed to different situations, and enables them to walk in the shoes of their employees with mental health conditions, to really provide more supported conversations and to feel the impact of their leader behaviour and communication style on their mental health condition when they go forward. So I don't think we've seen the end of technology enhancements and how they'll actually support people in the workplace going forward. I also really wanted to call out a little bit of a call out for the role of the claims manager and the insurer in this space. And I think that sometimes we can be quick to make comment about the quality of services that insurers and claims agents make. But if you're a case manager dealing with people with mental health conditions and their stories day in and day out, I can tell you that client centricity is at the heart of what they come in to do every single day. And it's important for us to make sure that they've actually got the supports that they need to be able to continue to do a good job in the workplace and thrive in the role that they do themselves. So we actually piloted with our own employees an app. It's Here's a Thought. It's an outwardly simple e-learning platform that educates employees, high school and university students on proven strategies to prevent, address and act on mental health and wellbeing matters. For Allianz, it was a secure, digital, scalable solution for our employees that deal with sensitive psychological workers, injuries on a daily basis. We knew that these employees were and are having to face difficult and sometimes overwhelming conversations in their jobs. Over 4 weeks, a number of our employees participated in the program. They received bi-weekly nudges and digital Here's a Thought cards via their mobile and desktops in order to tackle serious issues by communicating in a relatable way. So the results for us: 38% increase in confidence to deal with work and non-work related mental stress, a 19% increase in confidence to have a conversation about their own mental health at home or at work, and a 14% increase in knowledge of recognising their own signs of mental decline in the workplace. So I think an important, simple intervention that can be put in place. And lastly, they don't have to all revolve around technology and practices. Another key recommendation outlined in the actuarial paper was continued education and collaboration. So here are some of the actions we're taking here. A number of us are all working collectively around mental health. There's a number of toolkits that a number of organisations have put together. We've taken the research from the feedback we had from YouGov and also our own employer research that we'll be launching shortly to pull together our own mental health toolkit that we are using with our 1 in 6 employers that we're working with to help them lead the cultural change within their own organisations. We're also looking at social impact across Allianz more broadly. It's an exciting initiative that I'm really proud to be part of as part of the Allianz family. The social impact team at Allianz has established an enterprise-wide working group on mental health that involves colleagues from workers' compensation, from our product area, from technical pricing and product design, HR and our marketing team, to work collaboratively across the organisation to ensure we're meeting the needs of community, customers, when it comes to mental health in the workplace. And lastly, we're a member of Way Ahead Workplaces, a network of like-minded businesses which desire to improve mental health in the workplace. It's coordinated by Way Ahead Mental Health Association of New South Wales, and they play a vital role in the development of mental health initiatives, which increase the community awareness and knowledge of mental health. So my conclusion really is it's a journey that we're on. I think one of the questions we'll talk about on part of the panel is who takes the lead. I think we've all got a voice, we've all got a lens, and I think the most important thing is that we're starting to take the conversation into action. Thank you.